Hi everyone, my name is Chuck Ingoglia and I have the privilege of being the President and CEO of the National Council for Behavioral Health. We are the unifying voice of America's healthcare organizations that deliver mental health and substance use services. Mental illness is not a crime, but despite that, people with serious mental illness are more likely sent to jail or prison than to hospitals or treatment centers, and more likely to encounter police than a health professional, which furthers the stigma around mental illness and can sometimes be fatal. That must change. But how? Our nation needs something transformative, something community-based, something with 24/7, 365 crisis support, and something that removes first responder responsibility from law enforcement, a model that both behavioral health advocates and criminal justice systems can support. And wouldn't it be great if we didn't have to create something from scratch, but could use existing infrastructure and that would not require moving mountains to implement? Now, if you think this sounds too good to be true, I'm telling you, it's not. A model with everything I just described exists today. And I'm talking about certified community behavioral health clinics, or CCBHCs. Already, they are helping decriminalize mental illness in 34 states. The CCBHC model gives states and clinics the resources and flexibility to address the crisis we have in our nation regarding access to care. The CCBHC model creates a system to meet the needs of individual communities. It also alleviates the burden on the criminal justice agencies and reduces interactions with police. CCBHCs are improving and increasing access to crisis care and ongoing mental health and addiction treatment while reducing incarceration and recidivism. And we're already seeing life-saving results in 2/3 of the country. Implemented in 2017, CCBHCs are federally recognized clinics that provide a comprehensive range of addiction and mental health services to vulnerable individuals. Clinics must also create better care coordination with community stakeholders, including law enforcement agencies, in exchange for a payment rate that covers their cost of expanding services. Now, here's an example of how CCBHCs are designed to better serve communities. They are required to serve everyone who walks in the door, regardless of their ability to pay. People who are uninsured, insured, on Medicare or Medicaid, you name it. So already, CCBHCs are better positioned to serve people in need. 9 states have initiated CCBHCs through their Medicaid program, and federal grant supports clinics in 25 additional states. Today, there are 229 CCBHCs across the country. The results? Access to care has gone up, wait times have gone down, and fewer people are ending up hospitalized or arrested. CCBHCs provide 24/7 crisis services, which gives much-needed support to local law enforcement. In Oklahoma, a CCBHC established an outpatient program for justice-involved persons who were not court-ordered to receive those services. In the 9 months since that program started, the participants have had 0 rearrests and only 1 rehospitalization. In Oregon, a CCBHC partnered closely with community corrections and their local jail to provide on-site services. They also work to link individuals to services in the community when needed. The county with that CCBHC now has the lowest recidivism rate in Southern Oregon. And in Missouri, law enforcement has successfully referred 75,000 people to CCBHCs since 2017. But don't take our word for it. Visit our CCBHC Success Center online to find dozens of more state-specific examples, plus a locator of CCBHCs throughout the country and in your state. Our nation faces a pandemic, a mental health and substance use crisis, and a desperate need to change how those with serious mental illness interact with our justice system. These challenges are inextricably linked, and fortunately, there is a model that addresses all of these crises. CCBHCs are the answer. That's why we at the National Council for Behavioral Health have a plan to rapidly expand this model to help 500 clinics become CCBHCs by 2025. That means nearly 2.9 million more people will gain access to high-quality mental health and substance use treatment. You can help in this effort too. Reach out to CCBHCs. Learn how they are helping people stay healthier, preventing costly emergency medical visits, and promoting community involvement instead of a police response. Promote their work, partner with them, and contact your lawmakers to share what you've learned. Here's the bottom line. CCBHCs reduce police interactions for people with serious mental illness and substance use disorder, and if an individual becomes justice involved, the CCBHC model helps them too by unlocking funding for better care coordination between community treatment centers and law enforcement. Today's 229 CCBHCs are just a start. The National Council is working to bring a CCBHC to every community. Get in touch with us to join the movement. The CCBHC model is here. It works. Together, we will expand this successful model to all 50 states. I am so grateful to be able to connect with all of you today, and I would like to thank the Sozose Foundation for this leadership in convening this summit. I look forward to learning more and to working with all of you in our shared mission to decriminalize mental illness.